Our plan starts with mounting an aggressive, safe, and effective vaccination campaign to meet our goal of administering 100 million shots in our first 100 days in office.
Is that high enough? Shouldn't you set the bar higher? That's basically where the U.S. is right now.
When I announced it, you all said it's not possible. Come on, give me a break, man. That's a good start. 100 million.
Joe Biden bristled a bit when asked if his vaccine plan is ambitious enough, but there are big questions going forward as the COVID death toll threatens to climb past 600,000 in the coming months. Here to answer some of them, the president's nominee for Surgeon General, Dr. Vivek Murthy. Dr. Murthy, thank you for joining us this morning. Let's talk about that goal for 100 million vaccines in 100 days. As you know, many experts have weighed in saying the plan is not ambitious enough. We need to do better. Can we do better? Will we do better?
Well, thanks, George. It's great to be with you today. As President Biden has said, he set a goal of 100 million shots in his first 100 days in office. That's a floor. It's not a ceiling. It's also a goal that reflects the realities of what we face, what could go right, but also what could go wrong. And I think President Biden fully understands there's a larger goal here, as we all do, which is that we've got to vaccinate as many Americans as possible. And that's going to take a lot of work dispelling misinformation, working on the supply, increasing distribution channels. And that's some of what the vaccine plan that he announced over the last week is intended to achieve.
Are there ways to increase the supply, number one? And number two, on the distribution, it appears, at least in these first vaccines that have gone out, they've been going largely to wealthier areas of the country, largely to whiter areas of the country. Is there a way to get more equitable distribution and increase the supply?
Well, it's the right question, George, because success has to be gauged not just by the number of vaccines we deliver, but also by how fairly we deliver those vaccines, how equitably we deliver them. We already know from the COVID crisis over the past year that there are certain communities that have been hard hit by this virus, that rural communities have had a harder time getting access to resources, the communities of color have experienced more cases and deaths, that seniors have struggled, especially those in long-term facilities. And what we've got to do here is not just, again, increase supply, which we can do using the Defense Production Act, making specific syringes that can extract more vaccine from the Pfizer bottles, but we've also got to set up the kind of distribution channels like mobile units, like strategically placed community vaccination centers that can reach people who traditionally are hard to reach and don't have access to healthcare. And lastly, George, we've got to track our progress. We've got to make sure that we have data on where the vaccine is being administered so that we can ensure that it in fact is being distributed equitably.
How about the next vaccine, the Johnson & Johnson vaccine? Is that close to approval?
Well, we're hopeful that we'll get good news on that front, George, because the truth is the more vaccine that we have in terms of options, in terms of supply, the more quickly we'll be able to vaccinate the country. But what's important is that we focus and plan for what we have right now. And the goal of achieving 100 million shots in 100 days is one that is achievable with the supply that we have and that we're anticipating from Pfizer and from Moderna. And that's what we've got to focus on. So we hope for the best, but we've got to plan for the situation we have now.
I want to ask you about this variant of the COVID that is now in the United Kingdom. At least 20 states say it's here now as well. And the British Prime Minister, Boris Johnson, said this week there is evidence that it is more deadly than other strains. I know that last month you said we didn't have enough evidence to say that it's more deadly. Has that changed?
Well, I'm glad you're bringing this up, George, because the variants are very concerning, but they are not surprising because this is what viruses do. They mutate, they change, and we should expect that. But here's what we know. We know that the variant, not just the UK variant, but likely the South Africa variant, the Brazilian variant P1, are likely to be more transmissible. And while there's some early data that was reported on early this week that the UK variant may in fact be more deadly, we still need more data to clearly understand the answer to that question. But here's a larger lesson, George, from the variants. They are really a shot across the bow. The virus is basically telling us that it's going to continue to change, and we've got to be ready for it. And what does that mean? Well, it means we've got to, number one, do much better genomic surveillance so we can identify variants when they arise. It means we've got to double down on public health measures like masking and avoiding indoor gatherings. It also means investing more in something we haven't talked about very much recently, which is in treatment strategies, which have received a lot less attention than vaccines, but are really important. And above all, This means we've got to invest a lot more in testing and in contact tracing because these also are going to be essential. So the bottom line is we're in a race against these variants. The virus is going to change, and it's up to us to adapt and to make sure that we're staying ahead.
Are you confident that we can meet President Biden's other goal to get most elementary schools open in the first 100 days?
Well, that's a very important goal. I'll tell you, as a parent who has two young children, one of whom is trying to do virtual learning because his school is not open, and we're all struggling with that. I know how critical it is for schools to get open, for parents, for the economy, for all of us. It's going to take a lot of work, though, and on several fronts we've got to focus. Number one, getting clear guidance to schools on what they need to do to reopen. Number two, we've got to make sure schools have the resources to be able to reopen and take these measures. And a lot of them don't have the resources. I mean, keep in mind, George, that each and every day we have teachers across the country who are reaching into their pocket to find a few dollars to pay for supplies for their kids. They don't have money to pay for the safety provisions that are needed on their own. We've got to get them those resources. If we get them the resources and the guidance, I do think that we can get on a path to reopening schools more safely, but it's also going to take us getting the background number of cases down in our communities, and that's where we all come in. Achieving these goals, turning COVID around, is a goal that we have to undertake together as one nation, and if we do that, then I'm confident we can turn this pandemic around.
And finally, can we get to herd immunity before the next school year begins in September?
Well, I think that's an ambitious goal. I think we can see improvement. I think we can see reductions in cases and hospitalizations and deaths. I think we can see many more people immunized. But I think what's important here, rather than focusing on a specific number in terms of percentage of the population for herd immunity, is to recognize that the more people we vaccinate, the better we will do. The fewer outbreaks we will see, the sooner we can get back to our way of life. And that's what we've got to focus on right now. That means each and every one of us has to think about how we can dispel misinformation, make sure our family and friends have the right information. It means as soon as possible is when the categories are open to us that we make an appointment and go get vaccinated ourselves. If we do these things, and if we continue to work on taking the safety precautions like masking and avoiding indoor gatherings with people outside your household, then I think we can be on a path to not only turning the pandemic around, but most importantly, getting our schools open, our workplaces back up and running, and regaining our way of life.
Dr. Murthy, thanks for your time this morning.
Thanks so much, George. Good to be with you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.